For your health, medical history was made today in Frisco. For the first time in this region, a North Texas spine specialist implanted an artificial disc in the neck. Fox 4 medical reporter John Hammerly has your first look.
We do it unconsciously every day. A simple turn of the neck is one of those take-it-for-granted movements, unless
patients, as they get older, they will start to have some wear and tear on their neck, arthritis, we call it degenerative disease. They can also have trauma or a fracture.
that pain in the neck and or down the arm gets so bad for so many people that 250,000 times a year, doctors go in and surgically extract the damaged disc and fuse the surrounding spinal connections together. This fusion surgery has been used for years, but not without concern.
One of the things we worry about with a fusion is that when we stop the motion and stiffen the spine, that we change the mechanics of the spine, and that the levels next to the spine could degenerate more quickly.
Instead of fusing or freezing a damaged part of the cervical or upper spine, biomechanical engineers and surgeons have spent years perfecting an artificial disc that replaces the broken one, yet moves with the freedom of a natural disc. The first Medtronic Prestige artificial disc was implanted Thursday.
It also allows flexion extension, rotation, and side bending, which is what the cervical spine does as well.
The entire surgery took less than 2 hours, and the majority of that time was used to take out the patient's defective original disc and to clean and smooth surrounding surfaces on which the artificial replacement can be fastened.
Because the whole point of the implant is to keep things moving as naturally and as freely as possible, the patient's going to go home within 24 hours of her surgery, and she won't have any type of brace at all.
The patients who have disc replacements do better faster. They get more pain relief quicker, and their disability scores were much improved than the fusion group at 6 weeks. So they got better faster, and they got back to work faster.
I'm John Hammerly, and that is for your health.